With House Bill 1, the Texas legislature passed a 2-year, $250 billion state budget plan as the 2019 session came to a close in late May. This passage marked the end of an unusual session, marked by widespread bipartisan agreement on priorities including public school funding and property tax reform. Those priorities were honored in the end, with $94.5 billion going toward the funding of the education portion of the budget, an increase of 16% from the 2017-2018 budget cycle. Property taxes were also cut by an average of 8 cents per $100 valuation by 2020 and 13 cents by 2021. For a $250,000 home, that translates to a $200 tax cut by 2020 and a $325 tax cut by 2021. The reforms passed this year also include requiring voter approval when local governments want to increase property taxes by more than 3.5%. However, not all areas of the budget received bipartisan support. Despite the fact that 64% of Texas voters support Medicaid expansion, the majority Republican legislature cut Medicaid by roughly $900 million, leaving the Texas Health and Human Services Commission with the task of identifying specific cost-cutting measures. House Bill 1 underfunds Medicaid so severely, it all but guarantees leftover bills would have to be paid in the 2021 session. In March of this year, the Texas faith-based, nonpartisan Episcopal Health Foundation found that a majority of Texans believe that our state government is not doing enough to help low-income adults access the health care they need. Passed by the state legislature and signed by Governor Greg Abbott, House Bill 1631 bans red light cameras in the state of Texas. Supporters of the ban, such as State Senator Bob Hall, pointed out during debate that red light cameras violate due process guaranteed under the U.S. and Texas constitutions by creating a presumption of guilt on and shifting the burden of proof to the vehicle's owner. Numerous studies also show that red light cameras can increase the number of accidents at intersections where they are installed. Advocates of the ban additionally argued that the cameras open local governments to corruption. They point to growing reports of elected officials taking bribes and kickbacks in exchange for contracts with the companies that operate and maintain the red light cameras. The evidence and the consensus among lawmakers is that community well-being is ultimately harmed, not helped, by operation of the cameras. As a result of the legislation, the city of Dallas is no longer operating its red light camera program. However, all citations dated before June 1, 2019 are still valid and will be processed for payment. Also passed this session and signed by the governor is House Bill 2048, which repeals the much-maligned Texas Driver Responsibility Program, which adds large surcharges on top of ordinary traffic fines, prompting the suspension of millions of drivers' licenses. The program issued so many surcharge fees during its operation that in 2018, 1.4 million, or nearly 10% of all Texas drivers, had suspended licenses for failure to pay annual amounts as small as $100 for minor driving infractions. The vast majority of such infractions were non-public safety related. These included offenses like driving without insurance or a valid license. Lawmakers recognize that the program disproportionately impacts low-income drivers by creating an inescapable cycle of debt. Drivers who cannot afford to pay within 105 days automatically have their license suspended. This forces many low-income Texans to break the law and risk arrest and imprisonment in order to make their basic commute. When caught, these low-income drivers are sucked into an already clogged criminal justice system and plunged further into debt through expensive court fees and criminal fines. All this, despite the fact that they pose no greater risk to public safety than wealthier drivers who are able to afford the initial fees. In June, Texas became the 15th state to raise the legal age to purchase tobacco from 18 to 21. The fine for violating the new law, which takes effect on September 1st of this year, could run as high as $500. Military members are exempt. According to a 2017 report from the U.S. Surgeon General, 90% of smokers start smoking by the time they turn 18. Tobacco manufacturers have come under fire in recent years for tactics that critics say target kids and young adults, including flavored tobacco, colorful packaging that resembles popular types of candy, and more. The effort to combat youth tobacco use has bipartisan support, with Republican Majority Leader Mitch McConnell introducing a bill in Congress that would raise the smoking age nationally to 21. Tobacco use also has a disproportionate impact on our low-income neighbors. According to the Centers for Disease Control and Prevention, low-income individuals not only smoke more than middle and upper-class individuals, they suffer more from diseases caused by smoking than do smokers with higher incomes. The increased impact of these conditions on our low-income neighbors is due to a number of factors, chief among which is a lack of access to routine and preventative health care, such as regular cancer screenings and programs to help quit smoking.